Good afternoon, everyone. We are now live on Patient Advocates Transforming Healthcare, or PATH, Tuesday Table Talk. My name is Hala Dura. I'm a patient family engagement consultant and also the founder of PATH. We welcome our audience today to our talk on healthcare transformation and patient family engagement strategies and real-world applications. I'm happy to welcome our two guests today, Renee Marcus Hoden and Josh Traylor. Renee is with the Center for Consumer Engagement at Community Catalyst, and Josh is with the Healthcare Transformation Task Force. I actually had the opportunity to join in on some of the work that Josh and Renee did that we're going to be discussing today. So I'm really excited to have them on to talk about the healthcare transformation and change package and case studies that we worked on and learn more about the team's report and more about that work. As we all know, and in terms of patient family engagement, that has been an essential component as we look ahead in terms of healthcare transformation, infusing the voice of patients, families, caregivers, and even more importantly, communities in healthcare transformation work. And I know Renee and Josh will have a lot to share with us today. Just a reminder for our audience, if you are on YouTube and signed in, please feel free to join our chat and submit your questions, and we'll hopefully be able to get to them during this chat today. As well as I'm going to include some links in that chat to some of the work that Renee and Josh are going to be talking about this afternoon. So please feel free to jump into those links and learn more about the report, the change package, and the case studies that we'll be hopefully covering today. So Renee and Josh, again, thank you and welcome. And I would love to hear just a little bit of background about the two organizations you represent, and then maybe transitioning into the Healthcare Transformation Task Force work and the reports that I mentioned.
Great. Hala, thank you very much, and a pleasure to be with you today. So my name is Josh Traylor. I work with the Healthcare Transformation Task Force. We are an organization, a nonprofit based in Washington, D.C., that brings together payers, providers, healthcare purchasers, and patient organizations who are all dedicated to moving out of fee-for-service healthcare and adopting value-based medicine. So really trying to drive a shift from a healthcare system that focuses primarily on the volume of care that's being delivered to one that is looking more about the quality of care that's being delivered. And so yeah, that is really our wheelhouse, and we were very happy to be able to partner with Community Catalyst and to engage in this work. So just keeping that introduction brief, I'll turn things over to Renee to talk about Community Catalyst and about the case study work that we've done. So Renee, to you.
Great, thanks, Josh. So again, I'm Renee Marcus Hoden, and I'm the Deputy Director of the Center for Consumer Engagement and Health Innovation at Community Catalyst. For those who might not be familiar, Community Catalyst is a national nonprofit healthcare advocacy organization. We're based in Boston, although these days I could say we're kind of based everywhere, just like everyone else. And we work to bring the voice of consumers into debates about healthcare, and that is a whole wide range of issues and bigger debates these days. And the Center for Consumer Engagement and Health Innovation is really where our work around delivery system reform lives. And again, like Community Catalyst, or as continuation of what Community Catalyst does, we work to bring a consumer perspective to those conversations. And in the work that we've done, we have sort of specialized in thinking about how best to meaningfully engage consumers. And when we say consumers, we're really talking about people who are typically underserved, so or underrepresented in these institutions. And so we're thinking about low-income populations, we're thinking about older adults, people with complex disabilities, and people from racially diverse communities. And so we also, in addition to our policy and advocacy work, we also do consulting work with healthcare organizations. And we had the wonderful opportunity, because we're a member of the Healthcare Transformation Task Force, to partner together with them, and then with a wonderful advisory committee, including you, Hala, to start on a project that was really two parts, funded by the Robert Wood Johnson Foundation. And it really was looking at the under the hood of consumer engagement. So what does it really look like? What does it take? And so the first thing we did as part of the project was that we did a series of in-depth case studies with 3 different organizations that have really invested in the kind of consumer engagement, really at the organizational level. So we interviewed and interviewed many people at Children's Mercy, which is the children's hospital in Kansas City, HRH Care, Hudson River Healthcare, which is a federally qualified health center in New York, and then Trinity Health, which is a large health system with over 90 hospitals across, almost 24 states. So that's where we started. We understood, looked under the hoods. They gave us that wonderful opportunity, and then we took what we learned there and applied to the change package you referenced earlier, which I'll turn over to Josh to talk about a little bit more.
Great, thank you. So yeah, as Renee mentioned, the focus of this work was really to look at how healthcare systems, healthcare organizations were working to engage their patients and families and the communities really that they serve. And so we wanted to spend some time really digging into, when we say what it takes, thinking about this from a planning standpoint, from a staffing standpoint, how many people, how many resources do you as a healthcare system need to be prepared to dedicate to this work in order to, not just do lip service to it, but really to do it well. And so from our series of case studies that Renee just talked you through, we wound up developing the change package, which is an interactive website that Hala included in the comments to all of you. And the change package is really intended to take this, I think, very complex project, this very complex effort, and break it down into much more manageable steps. So if you're at a healthcare system and you're trying to figure out where you want to begin with this sort of work, the change package site is really intended to give you a good jumping off point for that. So we've broken it down into really 3 main sections. So we have a planning section that goes through everything from the role of leadership within a healthcare organization and how they really do need to be on board and focused in championing this work. And also talks about things like developing your budgets, determining resource requirements, developing a plan to engage the community, and really ensuring that you are including patients and family members in that planning committee effort, so that it's not only being planned within the confines of a healthcare system, but that you actually do have that input from the folks who are being served. The next section digs into the implementation piece, and we talk about recruiting patient and family advisors, diversity and inclusion considerations, things that you need to do as a healthcare system to retain advisors, making sure that people know that their input, their time and their energy and their effort that they're giving to you as part of this work is actually being listened to, and ensuring that you're closing the loop and demonstrating to people how you're taking your input, their input, and using it to improve the delivery of care or to improve the experience. And then finally, we talk about scaling. And I think what's really interesting with this project is that we talked to 3 very different sized organizations. Hudson River Healthcare, which I believe just went through a name change. I think they are now Sun River Health. But they're a federally qualified health center. They're located in New York and really have a very kind of regional focus. You look at Trinity Healthcare, they are a very large health system that spans, I believe, 25 or 26 different states. And then you have Children's Mercy, which has obviously a narrow focus on pediatric care, but they are one of the larger providers of that care in the middle of the country, located in Kansas City. And so we really wanted to try and find the common lessons learned from all of these case studies and figure out, when we talk about scaling, how do you do this in a primary care environment like a fairly qualified health center? How can you do this work well at a system that has multiple hospitals like a Trinity Health, where you might have one hospital in Idaho and another hospital in Michigan, and the exact solutions that you come to in order to be able to implement engagement strategies are going to be a little bit different. So you need some flexibility, but at the same time, you want some degree of sort of uniformity in terms of goal setting, what you're trying to accomplish with that work. The scaling section really digs into a lot of the considerations around that, and how do you take materials that you might have developed for one business line or one facility, and lower the activation energy, lower the barriers to entry for other folks who are trying to do that work within the organization that you're working for. So I will pause there. It's kind of a high level overview.
Thank you, Renee and Josh. Renee, I love that analogy. We looking under the hood, because I think that sometimes we tend to kind of really talk about things at such a super high level, but we don't necessarily get into the actual work on the ground. And I think what's really unique about this project and this team effort was that, you were able to share those case studies and really show that real world approach to this work. And so as we look at that approach, when I do lift up the hood and I look, I'm like, oh my gosh, where do I even start? Especially if it needs a repair, right? So, in that context, could you guys share a little bit about, the how and then really the why? We know with a car, we want to keep it running. We want to be able to get from point A to point B. And the same could be said with healthcare. You've got to keep everything running properly. But at the same time, if you're not sure where to even begin, how do you do those things to keep things running properly? And I think part of that large component was engaging, patients, families, caregivers, and communities in understanding what needs to be addressed and done is really important. Specifically, I think now, as we look at our current state amongst a pandemic and our current this national conversation around equity and racial justice and injustices, I think it's even more important to understand that how and really be driven by the why. So if you both could just share a little bit about the how from the case studies and the how in terms of what the change package, maybe a couple specifics about what we could share with our audience today, and then really maybe end us out in that conversation around the why and that patient family engagement component that really made up a large piece of this transformative effort.
So I'll start, and then Josh, you jump right on in. So the how, of course, could take us 2 days to go over, but that's very, very detailed in the change package. So again, we'd point you in that direction. I think that that's one of the takeaways, is that details matter when you're talking about people's lives, both inside the walls of that institution and outside the walls of that institution, and then the mixture. Again, details matter. And so we really tried to get into incredible detail around, and again, organizations can come at the change package from wherever they may be. As Josh explained, there's a lot of entry points, but everything from, what kinds of, recognition programs like gift cards, stipends, honoraria, meals, we really wanted to look at, like, how much should people should an organization provide, or what should an organization provide to honor the wisdom and the contributions and the time of their patient and family partners? We looked at, well, what kind of staffing does it take? What sort of, what sort of staff members have the right skills to, facilitate a focus group? We looked at, where people sit in leadership, because we really want to understand leadership buy-in. You have to have leadership buy-in, or otherwise it's not meaningful. So, where does the person or people who are, the point people around engagement, where do they sit in the organization? Quite literally, not literally where do they sit physically, but literally where do they sit in the organizational chart, and what kind of access do they have to to leadership? So, on that point, for example, I always think about HRH care, now Sun Care or Sun River Care, and how the person who was in charge of all engagement, and I'm blanking on her title, but she was the director of, let's say, director of patient engagement. She was part of the leadership team, and so she had the ear of the people who could make decisions around budget and what the board role might be, and engagement really across the organization. And she was doing focus groups, so she wasn't just hearing about it. She could relate examples straight from the ground, from the members and patients and families they were serving, right up to the top. So we really did try to get into that detail. And then I think we want to talk a little bit more about diversity later, but even like that's a great example of, like, it requires thinking about where people sit in the room. It requires thinking about how people address each other. So all of this is just to say, it's about so many details. But I think one thing I would leave you with before turning back over to Josh, who I'm sure could give you many examples as well, is that bottom line, one thing we found throughout this is meaningful work is what matters most. All those details absolutely matter, but if you're not giving your patient partners, family partners, member partners meaningful work to do, then they're not going to stick around. They're not going to have an impact. So I'll turn it over to Josh.
Yeah, thanks, Renee. I think in terms of considering the how, to build on some of Renee's points from a staffing perspective, I think one thing that struck us looking at the different organizations we spoke with was that you need to be, I think, very intentional about who you choose to lead the work. And oftentimes the folks who were leading up these efforts had a background in social work, or had been in one case, for instance, Children's Mercy, they actually brought 2 parents of former patients in on staff, and that became their job, was to lead up that effort. And so having a perspective, I think, that comes from maybe outside a more traditional sort of healthcare system lens, I think was very important there. And we spoke to a number of patients as part of these case studies as well. When we were out doing field visits, we actually sat down with panels of patients who were participating in these. And I think we had one group of patients that said something that I think really stood out, which was the person who was kind of leading up this work they viewed as being almost like a coach, in that she worked very hard to identify people who had specific interests in different parts of the healthcare system, and to place them in a position where they could use their talents and their interests and their experience, either as a patient or a family member or a member of the community, to maximum effect, to help inform the work that the healthcare system was trying to do, and to really identify for them some of the areas where they were falling short. And I think another point, and this is to the leadership point that Renee was making earlier, there was an emphasis on getting comfortable with bad news, getting comfortable with feedback that maybe you didn't perform to the level that you would have hoped, and how important it was for everyone to be able to actually hear criticism and not get overly defensive about it, but instead to focus on trying to solve problems. So one area that kind of a business insidery term that we heard on a few of these was service recovery, which is essentially from the health system perspective, if you had a really bad experience, how do we try and make that better? And we had one of the patient members was working on a service recovery team and providing feedback to them. And, she said, whenever I talk to you guys, you jump right into identifying the problem and then trying to tell me what went wrong. And you know what? I know what went wrong because I was there. And what I want is for someone to actually give me the space to tell you what went wrong and why that was a bad experience for me, and have you listen to me and then reflect back to me what you're going to do about that. Not have me, get on the phone and then tell me, well, you came in at this time and you left at this time and your paperwork got lost here and X, Y, Z. And so, she really stressed that a lot of this is just people being heard. And it's not always that folks want you to fix a particular thing, but they want to know that you're actually paying attention. And then I think just to transition to the why, if it's not too early to jump to the why of this, but I think there's a great body of literature out there about the benefits of this sort of work for patients, families, and the community. But I think part of getting the leadership buy-in here is also flagging how this is beneficial to the health system. This not only is good for people, but it makes good business sense as well. So we had a number of instances that folks pointed out where they were doing capital improvements, a construction project, and they engaged patients and family members early on. And they said, well, the way you designed this bathroom doesn't allow me to get my adult child with special needs into the bathroom and cleaned up and then back into their assistive device to move around. And so, if you had waited until you completed that bathroom, for instance, very concrete example, if you waited until you completed that bathroom, found out it didn't work, you would have had to do thousands upon thousands of dollars in renovations to sort of make that happen. We had examples from HRH Care where they pointed out how, and this actually came up in all three, they pointed out the staff morale actually improved when they were participating in these engagement activities, because for many of them, they entered into medicine because they wanted to have a more interpersonal touch. They didn't want it just to be a 15-minute visit and out the door. And so they found that things like employee retention and staff morale increased. And then also you have, in many instances, folks who had bad experiences, but were able to come in and share them and work with the healthcare system on improving the way that the care was delivered, wound up becoming some of the biggest champions for that system. So it is a way to not only, I think, improve the quality of care for patients, but it also can improve your, HR, interacting with your employees. It can inform the way that you actually build out space within a healthcare system and help you sort of guide where you make investments in a way that is going to be more effective and impactful for the care you deliver. So I will pause.
I'll just jump in. I know we're running short on time, so I'll just jump into the more whys. If that's okay, Hala? Okay, great. So, we did this work, as both of you know, before anybody had ever heard the word COVID, or before anybody had ever heard the name George Floyd. And the the rollout of these materials, combined with the urgency of the moment that we're in, both in terms of the pandemic and in terms of, this reckoning we're having on racial inequity throughout our system, makes this work even more important. So I'd say, the why was always there. Those things were always there. As I said before, and I think Josh did a great job talking about, the change that's possible inside the four walls of the institution. But I think that those walls have become that much more permeable since the onset of the pandemic, and again, since this new reckoning has happened. Um, it's almost overstated now to say, like, the pandemic has laid bare all of the underlying problems in our country, public health problems that range from our typical social determinants of health, a lack of housing, a lack of access to food, lack of transportation, and racism now, of course, has been added to that list. Again, some of us are coming slow, only now to the realization that racism is really at the root of all these things. And so the argument for consumer and community engagement is even stronger now. We can't shut our eyes to these things. They're right in front of us, and healthcare organizations can't shut their eyes to it either. So while one might think that this requirement of physical distancing means that we sort of put aside the nice work of consumer engagement, it's now time to double down on that, because of all of these challenges that are in our faces. And healthcare organizations don't need to do it alone, but they definitely need to do it in partnership with the people that they serve and with the communities that they serve. So, dedicating time and resources to working with and learning from those communities in multiple ways. I think multiple strategies is another lesson that we learned through the case studies. Is it can't just do it one way. You really need to do it a number of ways, but you need to, especially in this moment and forevermore now, because we've been changed, to place special emphasis on historically excluded communities. It's a moral imperative.
Yeah, I mean, I couldn't agree more. And I think, Josh, when he was sharing his example about, just being seen and heard. And I think that to me resonates so much and is such an important piece of this, that really it is just about people wanting to be seen, heard, listened to. And I think as we look ahead at what healthcare transformation could and should be, that really has to be the driver of honoring people being seen, people being heard, people being listened to, and underlined, acknowledged. And so I think, I will definitely make sure that our audience is aware of the change package and the report, so that they can take some of these lessons learned and hopefully apply it to our next phase of healthcare transformation. But I'll give you maybe the last minute or so, Josh, to kind of round out the conversation. As we look ahead, what do you see really as key drivers, and where should we really be leaning into?
Yeah, it's a great question. I think we are heading into the fall and into the winter. And I think broadly, public health experts are expecting that there will be a resurgence, likely, of COVID-19 in a number of communities. And we are simultaneously dealing with a challenge of conflicting messages, and I think a crisis in confidence in expertise and in the public health community, and maybe the healthcare community writ large. And so I think part of this engagement work and why it's important is that in this moment, one of the sort of best ways to have trusted messengers around what to do, how to stay safe, how to prevent a recurrence of a COVID-19 outbreak is to have trusted messengers who have a relationship with the community. And so some of the health systems that we've talked about today actually did, when the pandemic first really took off in the US, engaged with their patient groups to figure out how to talk to the community about some of the new safety measures they were putting in place to try and avoid transmission within the healthcare settings. And this really wound up involving very extensive rewrites of the scripts that had initially been come up with to make them more recognizable and understandable to folks. So I think that from a very immediate standpoint, I can see a great role for this engagement work, both again with patients and families and with community-led organizations who are well respected. I think that healthcare systems do need to be moving in that direction and focusing on that as a just as an area of work moving forward. It's going to be really key that I think people trust and understand the messages about how to avoid transmission, and if you do happen to contract COVID, how to keep your family members and your loved ones safe, and what you should do. So
Absolutely. Thank you, Josh. And thank you, Renee, for you guys both joining us today and for all the amazing work that both of your organizations and partners have done around healthcare transformation. I can see a part 2 to this, so I hope that that's in the pipeline at some point, especially looking at our current situation. But thank you both for joining us. To be continued. We could talk, I'm sure, for days and days and days, and hopefully we will slowly but surely get there. I'd like to thank our audience for joining us today on the Path Tuesday Table Talk. Join us next week, same time, same channel, where we will talk about patient-centered measurement, another great component of healthcare transformation. So we look forward to welcoming our guest, Karen Frazier of the American Institutes of Research, for that talk. And thank you once again for joining us, Renee and Josh, and thanks again to our audience. Josh and Renee, if you could just pause for about 15 seconds or so as we close out our stream, and have a great day, everyone.